Today is a special treat. We have with us a guest, Kristyn. Kristyn has a very special case. It's a very complex case of what's going on with her, with a plethora of different things going on, with some simple root causes that are causing this. So this isn't rehearsed. This is just raw and live, how I do a consult all the time. You're going to see how complex cases can have just simple roots causes to them. This is your Health Reclaim podcast, where we expose the root causes to fuel Lyme and chronic illness so you can finally heal. We help you understand and heal the root cause of Lyme and chronic illness so you can reclaim your health and restore your life. I'm Dr. Brad Montagne, veteran functional medicine doctor. We're at the tail end of our 4th decade, helping people who have seen the best doctors all over the world with no help at all. We help them restore their health and their life. Okay, so today we're going to go over a consult live. This has been an idea had for quite a while. We've got Kristyn with us today, and she's got a very convoluted, complex case, seen a lot of doctors and really not gotten very far with anything. So we're going to unwind this, and this one's really different. It's completely out of the box. There's nothing textbook in it. So this is going to be really, really interesting. So to start off with, Kristyn, I got a few questions for you so it brings me up to speed in what's going on. When did you start? I'll give a little bit of overview. You got 2 autoimmune issues going on inside of the eyes. One's against the macula, and that's where you get all your acute vision and all that. Another one's on the white of the eye going on, and you've had inflammatory issues using drops on your eyes to deal with the white of your eyes. How long have you been using those?
Yeah, so the macular degeneration is actually a genetic.
That's what they say.
That's what I've been told.
That's what they always say, but that's
Okay.
not what it is.
Okay, love that. So that started, I would say, probably 8 or 9 years ago.
Okay, so the drops started before the macular degeneration.
Drops started after that. Drops started probably about 5 years ago.
Okay.
And that's for just the inflammation.
Right. And I'm not sure if you're aware those are steroids you're using.
Yes.
Do you know what steroids deposit in every tissue in the body and cause degeneration in every tissue of the body, the eyes included? It's part of the mechanism that's going on. That's why I wanted to know which one was first, because this will accelerate the macular degeneration.
Yeah, actually, at one point I was on a high dose of the eye drops, and to the degree that it actually caused, sorry, I'm blanking on the word, where your eye gets really cloudy.
Yeah. You're talking like the lens of the eye get real
Right.
cloudy.
And
Yeah.
I can't remember what it's called, but it typically happens to people like in their 60s, 70s, 80s, but it was happening to me like in my 30s. And because of the eye drops, it exacerbated it to such a high degree that I had to have surgery to remove it.
Yeah, and that's never good. How about the LASIK surgery on the eyes? When did you get that done?
That was probably closer to 15 years ago.
Okay, so that happened before the macular degeneration.
It did, although looking back, there were some pieces of the puzzle that didn't make sense then, but do now. And that was at the time they were trying to, they put the eye things on you and twist it to get your eyes to 2020, and they could never get me to 2020. And they said, well, as long as you're okay with seeing like 2030, we'll do the LASIK surgery. And I was like, well, yeah, if that's the best I can get, that's it. And years later, we realized that it was probably due to the macular degeneration, that it actually started so long ago, but I didn't know because it was not strong enough that I was noticing much of a difference in my vision.
Okay. Okay. Um, what kind of tea is it you drink?
Tea. I only drink decaf tea. Occasionally I have caffeine. I do like chai lattes, but I usually will drink anything herbal. So like right now I have some peach tea. Sometimes I have like licorice in it, that kind of thing.
What brand do you usually get?
Sometimes the Trader Joe's brand, sometimes Yogi brand, um, and maybe a couple others in there.
Okay.
Yeah.
Yogi's clean most of the time. It's one of the cleaner ones. Traditional medicinals is usually the cleanest. Yogi's pretty close second in certain flavors, but not all
Mm.
of them are that way. And some of the teas are extremely toxic. Like Tivania that Starbucks bought, up to 27 different herbicides and pesticides in their tea. It's the most
Wow.
expensive
That's
you can
scary.
find, and it's toxic. It's really toxic. So mainline brands like Bigelow and all that, they're toxic,
Mm.
extremely toxic. And that's why I wondered, because you got a lot of toxic load, and we've got to figure out where the factors are in all that. And it's oftentimes innocent things like that that
Yeah.
people are not aware of.
Mm.
Um, how long have you been vegan, and why did you choose to go that way?
I've been vegan probably like 8 years, maybe 9 years. And I kind of felt like over the course of like since my 20s, I had just been slowly developing intolerances to food. Like in my early 20s, I developed a intolerance to dairy. But then I would still eat it, but take lactate pills so that I could digest it. And then I developed an intolerance to gluten, and that took me a while to figure it out. All I knew is I was just
Uh,
sick all the time, and I didn't know why. So I figured that out, and I cut that out of my diet. And then eventually I got to the point where I was like, I just did some research and I felt like I've already cut out dairy, meat. It, for me, it didn't matter either way. And I felt like um, I liked what being vegan does for the planet, for our bodies, and for animals. And so I decided to go that way.
okay. It sounds like most of the dietary changes was try and manage gut symptoms and everything else that went on. And it's just a matter of, since you don't have real direction, you're just guessing, trying to do stuff, right?
Yeah.
That's what most people do.
Yeah.
Um, the gut issues that you have, um, what typically goes on with those?
Like if I have gluten kind of thing.
Whatever you put the generic term gut issues, but there's not a lot of clarification. So I'm just
Okay.
asking some clarification.
Um, yeah, I mean, even with the diet I have now, I feel like I still randomly have pains in my stomach that I don't know. I a few years ago tried to talk to a doctor and they were like, "Oh, you're totally fine. Just take peppermint supplements." And
That's the
so
worst thing you can do.
I did that for a while, but the pain did go away, but it didn't really change anything. And so I stopped that, and now it still kind of comes back every now and then. But I feel like there's something going on there because my body can't tolerate so many different foods now.
Right.
That it just feels like there's something going on. Like I also cut out caffeine. I don't have alcohol anymore. So even with removing a lot of it, I still get these random pains. So it just makes me think there's something more happening.
Generally, there is. Um, Generally, there is. Last one, this seems kind of a skew one. What kind of cookware do you use?
So I just switched actually to stainless steel. But prior to that, I was using a nonstick pan. I mean, it was like a high-end one, but still nonstick.
Okay.
Yeah.
Okay, that gives me a background of a lot of
Yeah.
things going on. When we look at your history of stuff going on, and we take a big overview instead of focus on all these little symptoms, but we take a big overview, you got global signs of toxicity that are going on. That's dysregulated your whole hormonal system.
Mm.
When you look at starting your cycle at 11 years old, that's really early. It used to be before they manipulated our food supply. That was absolutely average in our country, 15 to 17 years of age. And it's a toxic food that keeps making that younger and younger and younger and younger. And it lets us know that your diet wasn't all the greatest
It
when
was
you're
not.
young.
It was
And,
terrible.
it dysregulates all those. You look at 5 pregnancies and 2 live births, that's thyroid. You got a bunch of signs of thyroid. The cold hands and feet, common with thyroid. The gaining weight without making any sense and never been able to lose it, that's thyroid. Being tired, sluggish, that's thyroid. Thyroid's 50% of a woman's cycle. It's responsible for 60% of the miscarriages.
Wow.
And they never talk about this. But all that's thyroid, and to have 3 miscarriages and 2 live births, that's overt thyroid, just that alone.
Yeah.
And then you add the other things, just more confirmation that that's there.
So my last pregnancy, where I had my second daughter, they did put me on thyroid medication for the first trimester.
Interesting.
But what was told to me was like there was no specific reason for it. Like my thyroid levels like looked fine, but they just wanted to be super cautious and give me every advantage is what they told me. And at the time I was like, yeah, of course I want to have a child. I'm going to do anything I can. And then after the pregnancy, they said, oh, well, we didn't tell you. Now you have to stay on this forever. And I was like, no, I don't want to. So I went off of it because I didn't want to stay on it and took multiple tests after that on my thyroid and it looked fine. Look, it was back to normal levels.
The labs typically do look fine because they don't look at the right things. The thyroid produces an inert hormone called thyroxine. Has no biological activity, doesn't do anything. Thyroxine gets converted on the peripheral tissues into the active forms, T4, 3, 2, and 1. They haven't really studied 1 at all, little on 2. They focus mostly on T3. Every time it converts, it can go normal and regular. Normal and reverse. The normal has biological activity, the reverse doesn't. The reverse still shows up in the test as if it's there, and it still registers in your hypothalamus. It registers all your circulating hormones as if it's normal, but it has no biological activity. We had somebody years ago we were working with overt thyroid issues. She's in her 50s, never had 1 cycle. Just a few wisps of hair she pulled over the top of her head to make her try and look like a woman. She was quite obese, could never lose weight. All these things went on. And after going back and forth between me and a medical doctor says, okay, have your other doctor order that test he was talking about. We ordered a test that shows normal and reverse. Her reverse T3 was almost 200 times what her normal was. Wow. 198 times. He thought it was normal. And that's what a lot of these labs do. They're so inaccurate, you would not believe it. But you just look at you're an overt shape of somebody with thyroid issues and adrenal issues. Your adrenals, they control your posture blood pressure, your kidneys, inflammation. With inflammation, the master gland over the immune system. They make all the precursors to the sexual hormones, pregnenolone and DHEA, get converted in both men and women, first to progesterone, progesterone to testosterone, testosterone to estrogen, and it have those conversions happen in the end point in different fractions in men and women, but the same progression goes on with all that. When there's a chronic stress, inflammatory issues, whatever is going on, all the pregnenolone and DHEA get shunted over to make your anti-inflammatory hormones. There's nothing left to build the sexual hormones. So you start to have atrophy of tissues. Women will start to lose volume in their breasts, and they start to get atrophy in their genitals. So same as male, they get a lot of rectal dysfunction, and the ability to get fulfilled when that happens is really cut off, and it's almost never addressed by anybody. Since women can still engage sexually without that, they ignore it, but you can't be fulfilled, and it's really frustrating, and it's extreme stress on relationships. So you've got the adrenal things going on, you got the thyroid issue going on with all this, and all that responds to overall toxicity. The primary source of toxicity is the gut. It's not what we take in from the environment. Over half the immune system is in the gut, and it's there because that's the primary route of access to everything that's toxic. We have 4 detox organs in the body: the small intestinal wall, the colon wall, the microbiota, the microbes that grow inside of the gut. Those are 3 out of the 4. In the liver, all the blood supply from the gut goes straight in the liver. The liver is supposed to catch what the gut doesn't deal with and deal with it and dump it back in the gut. And it's supposed to stay in this little loop from the gut to the liver, back to the loop till it gets dealt with, and then it can be excreted in the toilet. But when you have chronic gut function, like what you've had probably since you were really young, those detox pathways, they get impaired for a whole bunch of different reasons. The lining of the gut, if you hold your fingers up in front of your face, your fingers represent the microvilli, and that increases the surface area of the gut about 400 times. The microvilli, they secrete a mucus that fills the spaces in between the fingers and caps over the top. That's where all the microbes grow. When you got a chronic inflammatory issue going on, like 24 hours of severe, your fingers atrophy down, so you're just like looking at your knuckles. No place to make mucus, no place for the microbes to hide, and all the good ones wash down the toilet. All that's left is the pathogens to grow. Those pathogens, they make it so you don't digest your food. You rot it, you ferment it, and they create these super toxins. They create autoimmune responses basically everywhere. And you start to see those autoimmune responses first here, then there, a little bit in different places. And since people don't know that's going on, they're not aware of it, and doctors don't have the equipment to even assist such things. And they always say it's idiopathic, they don't know, or it's genetic, but they have no idea what causes it.
Yeah.
And they try and pin it on something. If they can pin it on something, then they can give you some kind of treatment. And a medical doctor, that's going to be some kind of drug, but it has no bearing on what the cause is. So you're thinking of something. What are you thinking of?
I was thinking about something that you said a moment ago about inflammation. And I'm curious kind of what the role that this plays in it. So we know I have inflammation in my eyes. I was at my ENT doctor yesterday because, and she said inflammation again, but I never thought of it that way. But like I have trouble breathing through my nose, and my Eustachian tubes are really narrow, which messes up, the pressure, and sometimes I feel off balance and that sort of thing. Also, it's hard for me to breathe through my nose, so it's kind of a big deal. But I wonder if the things that you're talking about could be like creating some of that inflammation too. Is that part of the picture?
Food intolerance is one of the biggest problems of lymphatic drainage problems out of the Eustachian tubes. The lymphatic fluid just puts pressure on the Eustachian tube and it collapses it so it can't breathe. Hard to change altitudes. The pops are typically fairly loud, a lot of history of ear infections, things along that line. The biggest cause of that is food intolerance. At least 50% of so-called ear infections is food intolerance reactions.
Wow.
That's out of the research.
Yeah.
There was a head of the ENT department in a research hospital, he was one of the talks of one of the, it was a functional medicine event that was going on. He did studies in his own department, and he found that everybody else in the department had twice the diagnosis of ear infection that he did. He did a survey of why, and it was how they did exams and what they're looking at. And he clued him in on what the difference, when you're looking at a food intolerance response, you got a light pink hue. And all the other doctors, every time they saw pink, they call it an infection. Infection's pretty obvious. They're ugly. They're really, really ugly, and there's no question on whether it's an infection or not. The food intolerance is not that way, but you create this all inflammatory issue. And if you notice under your eyes, it kind of got dark circles under your eyes. They look like they're a blue hue. That's a sign of inflammatory issues, adrenal responses, some hormonal dysregulation, other things along that line. You also see some blotchiness in your face that you may not necessarily notice a whole bunch. Those are autoimmune responses also. When we look at what causes autoimmune responses, it's always toxicity.
Wow.
We're supposed to be able to deal with the toxicity primarily in the gut and the liver, and we got two phases of detoxification. The first phase makes things more toxic, creates free radicals. The second phase makes them water soluble so you can excrete them. That should be in the toilet one way or the other, but when the system gets overwhelmed, it spills outside of the liver and the gut, goes systemic into the body, and the secondary elimination organs are the skin and the lungs. So whenever you see rashes showing up, it's toxicity because it's clogged detox pathways, impaired elimination, and it's trying to get out through the skin. Same thing with asthma. You see somebody like that, they're toxic, it's trying to get out through the lungs, and the lungs are responding to all the inflammatory issues. So what can't get out into the toilet or the skin or the lungs is start to deposit in the fat tissue, and once those tissues start to get too much toxin in them, the immune system no longer recognizes it as self, and it attacks it. It attacks a foreign invader. That's how every aspect of autoimmune issues goes on. You got all your neural tissues are high fat. The retina of your eye and where you get clarification, those neural tissues. High amount of fat. And you know, it's showing up in different parts. And they give these $100 names to these different things, but it's the same simple process. And you look at all of this, it's pretty clear. The reason I asked about the what kind of cookware you have, being a vegan for as long as you have, you also have hemochromatosis, the problem with iron where you absorb too much and you store too much, but a vegan diet doesn't have an intake of iron. You look at what you're eating, about the only food out there with much iron in a vegan diet is spinach, and that's not in what you're eating. So, the $100 question is, where's the iron coming from? Cookware, drinks, other things along that line.
That's a good question. That diagnosis was like from years and years ago, definitely before I was vegan. So maybe would be worth testing it again.
That's a possibility because it's, that's one of those things that the dots just don't connect at all. We're going to stop here and continue with this on the next episode. This getting a little bit long. We don't lose anybody. So tune into the next episode to hear the rest of this dynamic interaction with somebody with a real complex, convoluted problem named Kristyn.